let's start with being a psychiatric nurse practitioner. So essentially, psychiatric nurse practitioners are an advanced practice registered nurses, and they have specialized training in mental health. They provide a range of mental health services, including assessments, diagnosis, and treatment. They can either hold a master's or a doctoral degree. So the master's degree would be MSN, and the doctoral degree would be DNP. They will have a specialized focus in psychiatric care, but they can either have a master's level degree or a doctoral level degree. They are trained to provide both psychotherapy and medication management. Now, depending on what state you live in, there are some states that give psychiatric nurse practitioners a lot more freedom and independence to practice independently. Now, there are other states, on the other hand, where a psychiatric nurse practitioner would have to practice under the licensure of a psychiatrist, or at least maybe they would be independent, but when it comes to medication management, they would have to consult or refer a lot of their clinical decision making. So that's definitely one thing to be aware of if you are in a state that has a little bit more restrictive focus on psychiatric nurse practitioners. Now, as I mentioned before, the treatment focus for psychiatric nurse practitioners is doing a combination of therapy and medication. Depending on the setting, there could be some settings where a psychiatric nurse practitioner, for example, is in a hospital and they might only primarily be doing medication management. There's other settings where they could be in a community-based setting and they're only doing therapy and a little bit of medication management. And so it really does depend on the setting in terms of if the psychiatric nurse practitioners are going to focus more on medication or if they're going to also focus on therapy or a combination of both. I know a lot of psychiatric nurse practitioners who have their own private practice who mainly do therapy with a little bit of the medication consults as well. So it really does depend. Now, one thing that I want to clarify from my other video that I talked about in terms of the major difference between a psychiatric nurse practitioner and a psychologist, it is true that both psychologists and psychiatric nurse practitioners do assessment. But the types of assessment that they do is clearly different. With psychiatric nurse practitioners doing more medical-based assessments in terms of looking at the patient's medical chart history and their medical diagnosis and different things like that, the psychologist is going to do neuropsychological assessment or psychodiagnostic assessment, whether it's looking for personality disorders, whether it's looking for neurological disorders like ADHD, dementia, dyslexia, some of those different things. But the thing that really differentiates them from psychiatric nurse practitioners is going to be the neuropsychological testing and the psychodiagnostic testing. Now, there are some programs that might teach some of those things to psychiatric nurse practitioners, but I have not seen psychiatric nurse practitioners actually implement a lot of that learning or that training. They might have a little bit of it. They might obviously still be able to diagnose things like ADHD or dementia, but the way that they go about those diagnoses are going to look a little bit different than the way that psychologists might diagnose those disorders. And so that's just important to keep in mind. The main thing about psychologists is they write those reports, and those reports can be anywhere from 8 to 10 pages. Psychiatric nurse practitioners are not writing reports that are that long, right? So that is something that is kind of unique for psychologists in that we do a lot of research and teaching and writing of the assessments that we give to be very thorough in terms of the diagnosis that we make, whether it's some type of psychological disorder or some type of mental health or neuropsychological disorder as well. But typically you're going to have psychiatric nurse practitioners and psychiatrists who can prescribe medication. Now, again, there are some limitations for psychiatric nurse practitioners depending on where they get their licensure and what state that they live. It gets a little tricky with psychiatric nurse practitioners because there's a lot of different ways that you can become a nurse. You can have an associate's degree in nursing, you can have a bachelor's degree in nursing, obviously you can have a master's degree in the psychiatric nurse practitioning, and you can also get a doctoral degree in the doctoral nurse practitioning degree with a focus in psychiatric nurse practitioning. If you already have a nursing degree and you want to go into the mental health field, I think a psychiatric nurse practitioner is a great option for you. It's probably the least amount of time that you'd be able to put into in terms of getting that degree and becoming a psychiatric nurse practitioner. And you'd be able to do more things than a psychologist and actually prescribing medication. So that's a great option. If you don't have a prior nursing degree, then a psychologist might be a great option for you if you just want to mainly focus on therapy and assessment. Psychiatric nurse practitioners are going to be the ones to prescribe the medication, but they'll refer their patients to a psychologist for long-term therapy, and then they might consult with a psychiatrist if the mental health of the patient is really complex. But overall, all three careers can work in private practices, can work in hospitals and clinics and school settings, research settings. They can teach, they can consult, they can supervise, they can work in various different healthcare settings.